She was only 9 when her mother noted whitish spots on her face and neck. That changed her life. Mother was over concerned. She started projecting this kid 20 years in future. Ladies and gentlemen, we are talking about vitiligo. This diagnosis is not about your skin, it's about your identity, it's about your personality. This diagnosis hampered her all her life till her adulthood when she understood this is not any stigma, this is not about something she did or she's being punished about. This is about autoimmune disorder which affects 1 in 100 children and about 0.5 to 2% of world population is affected by this disease. In autoimmune disease, your own immune system start attacking your own body. In case of vitiligo, your immune system start destroying the cells which are called melanocytes, which produce the pigment melanin, which give color to your skin. If you lack pigmentation, it is more pronounced in darker skin cultures, darker skin people. Unfortunately, these communities culturally put a lot of value on the skin, and that leads to hell on the person who has been diagnosed. I've seen real time people change and replan whole future life, including childhood, education, cultural priorities, to the point that it is depressing and pathetic. Like any other autoimmune disease, there was no good treatment up till recently, when there is a lot of research has gone in to improve quality of these children and help them live a productive and a beautiful life which they deserve. There are 3 things which are going on in a patient with vitiligo. There is an autoimmune process, which is an inflammation mediated through cells which called T cell lymphocytes. They are coming in and destroying these melanocytes. If we have to research or treat vitiligo, we have 3 places where we could act. Number 1, we could do something to protect these melanocytes from the inflammation. Number 2, we could suppress these T cells, which are the reason the whole inflammatory cascade is started. And number 3, we could stop those chemicals which are produced by these T lymphocytes. The whole treatment based on one of the 3 things. We could supplement and augment the nearby melanocytes to grow into these patches or produce melanin to help to match the color of your normal skin tone. Research has changed significantly. Now, with the new cutting edge technologies, we know and we could measure the biological markers of inflammation, autoimmune activity, one step at a time. Melanocytes, we could protect them through narrow band UV light exposure and also new chemicals which are JAK inhibitors. They are the one which mediates the chemicals which are leading to destruction of these melanocytes. These 2 classes of drugs are really revolutionizing, and we are combining them in different combinations. JAK inhibitors are approved as an ointment and cream and as oral pills. These medications are very effective and they help to protect our melanocytes. T cells, we could suppress them with steroids and calcineurons. This is a class of medication which we use in organ transplant rejections, target derivatives. These medications stop these T cells so that they don't start the cascade of inflammation. And there is a lot of research, especially with the calcineurons coming into play and local JAK inhibitors, they are helping us. Number 3, the medications which are completely stopping the cytokines from acting out, even if this whole process gets started, are the JAK inhibitors. So JAK inhibitors are helping you in both places, stabilizing and preventing the stimulation of T cells to start the cascade of inflammation, and also if it breaks down and start producing it, it will stop those cytokines or the chemicals which carry out the destruction of melanocytes. Gut skin axis. So far we know gut brain axis, gut heart axis, but gut has been showing lot of connection. The gut microbiome, the bugs which are living normally into our gut, they are very important, especially from the species which are beneficial to human beings. They are producing certain chemicals when they're combined with the narrowband UV light and other medications. They are showing significant improvement. Diet is very critical for patients with vitiligo. Diet which is high in antioxidants, berries, kale, spinach, green vegetables, and also diet which is high or dense in nutrition, which has high component of vitamin D, B12, folic acid, and minerals, zinc. They all contributing to treat and to support your natural immune system. Lot of research is going on, and above all, artificial intelligence now is helping us to monitor those patches. The artificial intelligence powered apps can find out changes in those patches lot more precisely and lot more earlier than human eye can do that. I think going forward, the future treatments and the mechanism which we are finding in research of vitiligo are really encouraging, and I hope we will have more groundbreaking medications. This was a disease which did not have any kind of a suitable treatment. Now we could treat with these medications up to 60 to 70%. If your disease becomes stable and there is no recurrence and there is no activity, now skin transplants, where we take skin from one part and transplant in those patches where melanocytes can grow, have shown significant improvement. So from knowing the pathological mechanisms, knowing melanocyte, knowing T cells, knowing chemicals, now the whole spectrum and circle is getting completed. And I hope as we go along, we will learn more, know more, and we will be able to create suitable and effective medications. And subscribe to our channel, Kundalus MD. Thank you very much.